What happens to your body when you use testosterone therapy for older men? Testosterone therapy for older men has surged in popularity in recent years, often touted as a way to reclaim youthfulness, improve energy, and boost sexual health. However, the treatment is not without controversy, with concerns about its long-term effects and potential risks. In this video, we'll dive into the history, science, and current guidelines surrounding testosterone therapy. By the end, you'll have a clearer understanding of whether it's the right option for you or someone you know. The early history of testosterone and its use. Humans have long been aware of the powerful effects of testosterone. In ancient times, castration was used to manipulate behavior. Slaves were often castrated to make them more docile, while eunuchs were sometimes employed to preserve their voices for singing. In fact, Roman men believed that eating animal testes could boost strength and virility, a practice that stemmed from their observations of testosterone's effects. In the late 1800s, a French scientist self-experimented with a mixture from animal testes, claiming it boosted his strength and energy. While the scientific community was intrigued, it wasn't until the early 1900s that the substance in question was identified as a hormone, testosterone. The science behind testosterone therapy. It wasn't until the 1930s that scientists successfully synthesized testosterone, marking a significant breakthrough in medical science. Initially, testosterone therapy faced many hurdles. Early methods, such as oral testosterone, were ineffective because the hormone was broken down by the liver before it could enter the bloodstream. Other forms, including injections, showed more promise but had risks, such as liver toxicity. In the 1990s, the development of a skin patch revolutionized testosterone replacement therapy, TRT, providing a reliable and effective way to maintain normal testosterone levels. Today, gels, injections, and patches are widely used, but the growing demand for TRT has sparked controversy over who should use it and why. The surge in popularity. Testosterone therapy began to gain traction when health influencers and media outlets touted its potential benefits. Men, particularly those over 50, were eager to embrace the treatment, hoping to enhance their strength, energy, and sexual function. Sales of testosterone prescriptions skyrocketed, jumping from $100 million in 2000 to an astounding $2.7 billion by 2013. However, this popularity led to the second issue. Many men began seeking testosterone therapy despite not having clinically low levels of the hormone. This phenomenon is problematic because, while testosterone naturally declines with age, it doesn't always result in clinical symptoms. As a result, many men were using testosterone therapy without a clear medical need, and this has raised questions about the treatment's long-term safety. The benefits of testosterone therapy. Clinical evidence supports the idea that testosterone therapy can significantly improve symptoms in men with clinically low testosterone levels. These benefits include increased libido, improved muscle mass and strength, and enhanced bone density. In fact, one study found that after 10 weeks of testosterone therapy, participants showed increased muscle volume and strength, along with improved bone density. Furthermore, multiple studies have demonstrated that testosterone therapy can help alleviate depression, fatigue, and a low sex drive, common symptoms of low testosterone. However, these benefits are most evident in men whose testosterone levels fall below the clinical threshold, indicating a hormonal imbalance. The risks and controversies. Despite the benefits, testosterone therapy is not without risks. One of the most concerning issues is the potential cardiovascular risks. Studies have shown that testosterone therapy can lead to an increase in red blood cell production, which can contribute to higher blood pressure and the risk of blood clots. In some cases, these issues may even result in heart attacks or strokes. While the evidence on this matter is still inconclusive, some studies have raised alarms about the potential risks of testosterone therapy. For instance, one study found that testosterone therapy may be linked to plaque buildup in the arteries. However, other research has suggested that testosterone therapy does not significantly increase the risk of heart-related issues, and the evidence remains mixed. The transverse trial and its implications. A recent study, the transverse trial, has sparked a wave of debate. This study focused on over 5,000 middle-aged men with pre-existing heart disease or a high risk of it. After 2 years of testosterone therapy, the study followed participants for another 3 years to assess cardiovascular events such as heart attacks and strokes. The findings were surprising. The incidence of heart problems was similar in both the testosterone and placebo groups. At first glance, this suggests that testosterone therapy may not increase the risk of heart disease. However, experts have cautioned that the study's design, particularly its high dropout rate, around 62% of participants, raises doubts about the validity of the conclusions. Additionally, many men in the study did not reach the target testosterone levels, which may have affected the results. What you need to know about testosterone therapy. So, what should you keep in mind if you're considering testosterone therapy? The clinical guidelines recommend that testosterone therapy should only be used for men who have clinically low testosterone levels, accompanied by symptoms such as low energy, depression, and reduced sexual function. The benefits of testosterone therapy are well documented in these cases, but they are less clear for those who are simply experiencing age-related testosterone decline. Furthermore, it's essential to address any underlying health conditions that may be contributing to low testosterone. Obesity, diabetes, and chronic illness are all known to lower testosterone levels. Losing weight and engaging in resistance training can help naturally boost testosterone levels. And this should be explored before considering hormone replacement therapy. Finally, if you're exploring alternative methods to boost testosterone, some supplements, such as betaine, TMG, have shown promising results in improving testosterone levels and athletic performance. However, many other supplements lack scientific backing, so it's crucial to approach them with caution. Conclusion: testosterone therapy can offer significant benefits for men with clinically low testosterone levels, particularly in terms of improving mood, energy, and sexual function. However, it's not a cure-all and should only be used in appropriate cases. The current guidelines emphasize the importance of addressing underlying health issues and carefully considering the risks before opting for testosterone replacement therapy. If you're over 50 and considering testosterone therapy, make sure to consult with a healthcare provider to weigh the potential benefits and risks, and consider natural alternatives like exercise and weight loss to improve your testosterone levels.